there is the sentiment of sequence all the things, and I'm all about sequencing all the things, but it doesn't give you all the answers. Exactly like you said. I think it's meant to support, not supplant genomic epidata. Like this is one more piece of the pie that adds to the context of the epidemiological associations. Welcome everyone to the Bioinformatics Lab podcast. I'm Kevin Libuit with Andrew Page. We're from Fusion, and today we're talking about the various needs that are really specific to public health laboratories that are performing pathogen genomics. And there's a number of different threads we could pull on, and this will for sure not be the only time we have this kind of a conversation, but we can start even at the different audiences in public health laboratories and the different types, actually maybe sometimes the same type of data that may need to be communicated to different types of audiences and the considerations there. So Andrew, do you have any thoughts on that particular subject in public health?
Yeah, I guess as a bioinformatician, you can get very deep into the weeds and you can only think about, the command line and, these vast amounts of data and what you can pull out. And, while you can see like matrix style, you can pull out and say, oh yeah, that's something or that's something. Um, Actually, for many people, they want different things and they interpret information different ways and they can see this as information overload. So like if you were to try and present some complex genomic data to like your mother, you might take a very different approach to your colleague who works in bioinformatics, and that's really hard. Particularly, the non-scientist is probably one of the hardest people to convey complex information to. Torsten Seaman actually has a beautiful figure that he uses to explain phylogenetic trees, and it's with candy bars and the evolution of candy bars and what is similar and what is different. And it's a classic slide that he's used, but it really does highlight that you can use very simple concepts and people can go, oh, actually, yeah, I get that. Um, and it's the same with bioinformatics data. Like during the pandemic, obviously we saw with SARS-CoV-2 there was variants of concern, and then it was trying to convey this complex information to the public, which is quite difficult. I was doing it as well on TV and radio quite a lot, conveying information to the general public in a very very simple, clear manner. You have to give some technical information, but you can't give too much. And it's a balance, and then you don't want to scaremonger, and you don't want to uh, underplay with the value of genomic data when you're doing genomic surveillance. And so that's a hard one. Like that is probably the hardest. How do you make it succulent?
Yeah, and the audience that we work with, and I think a lot of bioinformatics scientists work with, is inherently broad, because likely the bioinformatics scientist is like deep in the trenches of a technical world, and the way they receive their training is with other practitioners, and they have this specific language at the really crazy granular level of what's happening in these algorithms and how to process data and the results and things like that. So that's the lexicon they have going into most conversations. But in a lot of settings, they might be the only bioinformatics scientists who can interpret that data. So they will be in a position where they have to communicate that to their other stakeholders who don't have that same vocabulary of language and understanding of these complex processes. So going from speaking with PhDs in the field to speaking to a general wide audience, like that's pretty much as wide as it gets in terms of an audience spectrum for people to take in mind. And I think you hit on a good one there. The power of analogies in being able to communicate these, finding that relatable thread of, okay, what's a similar concept? Okay, let's go with candy bars. I know another big one in our field is, when you're describing DNA sequencing and assembly, is ripping up a book or something of the sort and then trying to assemble it back together. And that's maybe the most extreme examples, but there's also even narrower forms of communication where you are speaking to a scientist, but maybe not a bioinformatics scientist. So I know this is definitely a challenge. And that goes both ways too. Like a lot of the conversations of laboratorians and bioinformatics scientists, there's a bridge that needs to be built with genomic epidemiologists, or even just epidemiologists perhaps, without the genomics background. And so there's concepts happening on the epidemiology side where they're, also deep and entrenched in their own nuance, and they're trying to communicate those ideas to a bioinformatics scientist who maybe we don't have necessarily that language. So we're both trying to play that game of telephone a little bit of like, all right, how do I communicate this to inform the public health action? So I'm curious on your end, maybe not on the general audience, but what about the different public health audiences? How do you gear your communication style to maybe an epidemiologist in this case?
That's quite hard. So an epi or say infection control doctor, they will have their own worldview of information they've collected. So maybe they've gone and done analysis of patients and wards or people who contracted a particular illness, and they have their own hypothesis, and built on many years of experience. And it's the data's there in front of them. It might be that maybe everyone in this restaurant had chicken, and you're like, and then they all got sick. So clearly they all had the same thing, and then the genomics come back and it says, well, actually, no, none of them had the same thing. They all had, something totally random, like, I don't know, norovirus, and it was because of the oysters they ate 2 days ago. Um, and, it's only when you're confronted with different types of information will you understand that your worldview could be changed. And then trying to convey that, trying to change people's minds to trust what you're saying and trust the data can be quite difficult. And so conveying information to medics, I know, and to epidemiologists can be difficult in some cases, but in some cases it's fine. um, but often they'll say, "So what? So what that you've gotten this level of granularity, and you have to actually educate them and tell them, well, this is what it means, and this is the action that you could take." So, for example, sometimes people only want to know what is the species. That's it. Doesn't matter because it doesn't change their actual the way they're going to treat a patient or what intervention is going to do. Whereas, for us, we're like, oh, well, this is only 3 SNPs from this other person over here. So clearly, it's an outbreak of some prescription. And, you'd have to explain and say, how confident you are in this and what action could be taken. And then say to explain the nuance of AMR predictions. So there's a huge difference between growing something in the lab and testing different antibiotics against a microbe, against isolates, versus predicting resistance, where there's a snip there and it might be mostly resistant but not totally, it might be intermediate, and it is very nuanced, or you might need multiple SNPs or multiple genes to actually have the full scale resistance, but there's some of it there, and so it can actually be super nuanced. What's your opinion on that?
I was actually asked this yesterday. I was given a Phage webinar and somebody asked, hey, what's my opinion on communicating these kinds of results to Epi? Should I include a SNP tree? Should I put a matrix in there? Should I just maybe draw a narrative of the outbreak and what I'm finding? And my gut reaction was start with an educational conversation, exactly like what you're saying, that let's first find the baseline of understanding and build upon that baseline so that we can maybe even identify what are the preferential types of visualizations or communications for your stakeholder specifically. Because I don't think yet we're at the point where there is that gold standard of how to communicate to EPIs, because there's still that educational gap that needs to be built. So I would say at present, the best practice really is start the communication and educational groundwork before defining exactly what the endpoint is going to be. And we found that to be really useful in the laboratories we work with at Theogen. And the conversation of genomic communication is we're starting with so many laboratories on education. What can we do with genetic data? We're lucky enough to have folks on our team who are true to term genomic epidemiologists, and Emily Smith, and she can really speak both of those languages. She's kind of the person who can go across those lines and say, actually, in the conversation of epidemiologists, this is the framework where we're talking about it. And she's not using just analogies of candy bars and things like that. She's able to go in and actually use their language. So I think that's where sometimes, especially when it's really two technical fields that are trying to communicate with one another, because we both appreciate nuances and these details, the analogies sometimes fall apart. Whereas somebody who speaks both languages, as it were, is really helpful to kind of communicate and build that bridge for us. And I think if we get enough of those activities going on, you're going to see proper curriculums being built on the epidemiologist side, where maybe in 2 to 3 years we'll see that best practice, and we'll see that community understanding of how to interpret a phylogenetic tree, how do we map that against the epi trends and data, and then we'll have a report that's okay. This is the endpoint. This is how you communicate this information, because both sides of the coin will understand what the best practices are.
And also, it's about knowing the limits and communicating the limits of what is there. Someone might look at something and go, "Oh, you gave me this disease," whereas we might know, it's true because we're domain experts. Actually, say this pathogen will go through 10 people, before it has a single mutation. And actually, it does not prove that there's been a transmission event. And it's knowing the limits and knowing the nuances as well, or knowing that just because you have a lot of SNPs doesn't mean that they're quite different. It could mean that it's a poor assembly. It could mean that maybe it's a mixed colony. There's a lot more nuance there. And like, that's where you need these domain experts to really, drill into it and say, actually, this is or isn't how it should be interpreted. And I guess we're kind of reading the tea leaves. I don't know, is that an expression in America? But trying to predict trying to see into something that maybe isn't there, and you have to be very, very clear on how confident you are in a result and confident in what that means, but also confident in what it doesn't mean, and where those limits are and where those boundaries are. It can be difficult, and particularly when people get excited about genomics, thinking it can solve everything. It can't, and just because you're an expert maybe in plant genomics does not mean that you're an expert in analyzing viral data or bacterial data, for human pathogens, because all of these things are very, very different.
Communicating the limits is huge. I think that's exactly right. Like, and I think we saw that too in COVID-19 pandemic, of course, but on and on of there is the sentiment of sequence all the things, and I'm all about sequencing all the things, but it doesn't give you all the answers. Exactly like you said. I think it's meant to support, not supplant genomic epidata. Like this is one more piece of the pie that adds to the context of the epidemiological associations. The language I tend to use is that genetic relatedness is a proxy for an epidemiological association. It's sort of an index for you as like, hey, there's likely something here. It's more probable when we see this than otherwise. So this is worth continuing to look into. It's not necessarily the final nail in that coffin there, but it's meant to, okay, now how does this associate with the epidemiological information? And we're harking on this exact example because of communication, because it's so pertinent in public health, is how do you communicate this kind of complex information to the epidemiologist? So I think it's one that is worth continuously bringing up as a topic, because that's really where the rubber hits the road in public health, of being able to generate this data. Now we're at a point where we can routinely analyze. We have systems in play that are pretty mature for reproducibility and interoperability. Now, how do we inform action? And when we inform action, requires an ability to properly communicate to this specific audience.
Absolutely. I don't think this is something we can ever solve, this translation between people. And, ChatGPT is not going to solve this ever. It's just we speak different languages, we say different things to mean the same thing, we have different understandings. And it does require, people who span those disciplines to be able to translate in an effective manner. Um, anyway, it is a very, very nice problem, and it's been great chatting to you today about it.
Absolutely. And I think in my head, I'm sparking ideas that we got to bring on a genomic epidemiologist on this to get their insights. So we balance the scales a bit. But yeah, that's it for today. And we'll see everyone in the next one.